Hello, I'm Dr. Andrew Weil, and I'd like to tell you why I support licensure of naturopathic doctors. I have a long history of working with naturopathic doctors, starting in the 1970s, 1980s when I was living in Tucson, Arizona. I worked with naturopathic doctors and learned from them a lot of useful therapies for managing common health conditions. In the 1990s, when I started the program in integrative medicine at the University of Arizona College of Medicine, I got naturopathic doctors to join our clinical faculty and sit in on our patient conferences and be teachers to medical students and physicians going through our intensive training programs. I think naturopathic doctors are very well trained today and well trained to operate within the scope of their practice. I also think there are natural partnerships between naturopathic doctors and medical doctors that are useful to both, and I see many opportunities for naturopathic doctors working in integrative medical clinics, which I think will be one of the forms of medical practice of the future. I think this is a natural partnership that can be very useful. Many of the measures that naturopathic doctors are trained in I think can lower healthcare costs because they're treatments that are cheaper and safer than the standard ones used in conventional medicine. And I also think that naturopathic doctors are very well trained in the whole area of lifestyle medicine, actually more so than conventional physicians. So they're in a very good position to advise patients about making better lifestyle choices that really have a great emphasis on prevention and can help reduce risks of chronic disease. So for all those reasons, I think it's a very good idea to license naturopathic doctors in New York and elsewhere. I think it really helps improve the general health of our population, lowers healthcare costs, and improves healthcare in general.
Upon researching what school I was going to go to, both conventional and naturopathic, I compared the two curricula and I realized that the two were comparable. We have the same amount of course hours, class hours, subject hours, clinical hours. Everything is comparable.
And it took them 11 days prior to going into the hospital, during which point I was gradually getting worse and they couldn't figure out why, and 9 days in the hospital and they still didn't have an answer for me. With naturopathic medicine and my condition, I feel like I'm better. I'm going to stay better. I'm going to stay out of the hospital. I'm not going to have the surgery. I'm not on these bad medicines.
My wife was on her last legs, I would say, in August from the debilitating chemo and the disease. She rebounded from her illness, so much so that within, I would guess, less than 2 months, she was doing everything that she had done before her ailment took over her body.
My name is Dr. Robert Kennel. I'm a pediatrician, have been for about 35 years. I'm an allopathic physician, and I've been in the state legislature in Arizona for 6 years. Naturopaths have been licensed in Arizona for many years. They have their own board, and we did expand the amount of drugs that naturopaths could prescribe with the blessing of the allopaths here. I've been to the school, sat in classes in the school. These are science-based classes. I found the naturopathy students, just like allopathic students, work on cadavers, have laboratories, studies, and study physiology and anatomy, just like I did in medical school. And then I spent about a half a day at a clinic that the naturopaths have in Scottsdale, Arizona, watching a young man who basically works as a pediatrician, seeing children, doing well care. And I was impressed the thoroughness of the well care. Medical exams were very good. My experience has been they're very quick to know their limitations, very quick to refer to specialty care if it's needed. And as I say, as a legislator, I think, and I speak for most of the legislature, we're quite comfortable with the situation with naturopaths in Arizona. And I think they do add a significant amount to the health care of our patients.
There is a real danger for the population to be taken in either by hucksterism or by dangerous medical treatments. There was a death of a young girl in North Carolina a number of years ago by a non-medically trained person who claimed to be an ND.
With me today is Dr. Mona Morstein, Chair of Nutrition at the Southwest College of Naturopathic Medicine.
The naturopathic physician is a very interesting mix of standard Western allopathic medicine with the concepts and philosophy of alternative medicine.
Hi, I'm Kathleen Field. I'm a mother of 3 children, ages 16, 13, and 7. All 3 of my children suffer from Crohn's disease, which is an autoimmune disease of the intestines. My children have been treated naturally through naturopathic medical care, and through this care they have been in remission, have never had to take one pharmaceutical drug. They are healthy and they are happy children, and we owe this to naturopathic medicine.
I want to tell you that above all else, in naturopathic medical school, I'm learning how to be safe. I'm learning how to understand my patient's needs and to know when something can be treated in the outpatient setting or when it's an emergency and they need to be sent to the emergency room.
The medical community, the conventional medical community, is also full of wonderful nurse practitioners and doctors that are willing to work with us.
Educate our students so that they are not just good critical thinkers and good clinicians on their own, but they're also fluent in conversing with other health professionals. We are serving over 25,000 people a year who otherwise have no access to health care.